The biggest problem with American healthcare system is that it costs too much. And the way inflationary pressures are actually built into it. Businesses and families pay more and more every year to get what they often consider to be inadequate or poor health care. And those who want to buy insurance are often unable to because of the high cost. What more compelling evidence of the problem do we need than to note that General Motors now spends more for health care of its employees and retirees than for the material required to manufacture its products, steel. The price of every General Motors car includes over $1,500 for health care costs compared to Toyota, whose total cost for health care per car is about $200. How can you be competitive in a situation like that? The growth of costs affects everyone. Government overspending, business costs and family budget. It hurts those who have insurance by making it more expensive to keep. And it hurts those who don't have insurance by making it even harder to attain. I believe Americans want to be part of a system that offers high-quality care, that respects their individual dignity, and is available at reasonable cost. Unfortunately, the American healthcare system, as it is currently structured, fails this test. It is too expensive. My friends, it is too expensive. It insults our common sense and dignity with excessive paperwork, disconnected visits with too many specialists, and by elaborately hiding from us any clear idea of what we're getting for our money. We must reform the healthcare system to make it responsive to the needs of American families, not the government, not the insurance companies, not tort lawyers, not even the doctors and hospitals.
The problem with health care in America is not the quality, it is the inflation. And in all due respect to your expert that we just saw, that he's talking about the wrong aspect of this issue. The right aspect of this issue is inflation. If we could get it under control and get it reduced so that health care costs are reasonable in America, then those people will be able to afford
to get health care costs.
And they will be able to go out and choose their insurer anywhere in America, and they will be able then to get affordable health care in America. But we have to make the recipient of the health care more responsible. We have to have outcome-based results for health care. We have to emphasize wellness and fitness. One of the most disturbing things in America is the increase in diabetes, obesity, and high blood pressure amongst younger Americans. So we have to reward wellness and fitness.
Charlie,
and that way we will have a healthier nation, and we will have less health care costs.
Senator, you've said, and again here this morning, that the biggest problem with the American healthcare system is that it costs too much and the way inflationary pressures are actually built into it. But most health economists believe the primary drivers of higher health costs are new technologies and increasing utilization of healthcare services. Your plan doesn't include anything specific to deal with those. Do you propose to lower the rate of growth of healthcare costs by limiting access to technology or the use of those services? And if so, how would you do that?
I don't, Julie, but the fascinating thing about health care in America, and medical care, that every time there's an innovation and an advance in technology, and there have been so many in our lifetimes, it's astonishing. Most of them came from the United States of America, as we know. Every time that's happened, costs have gone up. In the rest of the nation and the world's economy, every time we've made technological advances, costs go down. Now, why is that? Why should that be? I think it's pretty, that there's a number of factors. One of them is that every time there's a new test or a new technology of some kind, doctors use it because they practice defensive medicine. And that's an argument for medical malpractice reform and tort reform. Another reason is because we don't use these efficiently, not just because of medical malpractice. We use them to great excess when they're probably not necessary to do so. And third of all, this whole issue of how we set costs through Medicare has to be examined. We all know that everybody games the system, And when you have a technological advance that makes it much simpler to treat some illness or disability, somehow the same costs as before are laid on it. So we need to examine how we implement new technologies, how it affects healthcare costs in general, and whether we are just sticking with the old costs even though they're more efficient and less expensive. But it certainly is one of the great contradictions in America today, that should be, every time we do better and make it better and easier to treat people, the costs go up rather than go down.